went on the other foot, cut a hunk out of it.
Ouch.
And I couldn't even feel it till the blood was running.
Oh, jeez.
I'm going to have to ask somebody to trim them for me. I'm not going to ask the goddamn doctor. He'll send me up to Dr. Dencher, the podiatrist. He'll send me up to him, and he'll charge me about $150 just to... Yeah, I used to go to him, and that was when I had insurance. And I couldn't pay the insurance anymore, and then I had to start paying him. And he charged me $150 a trip. Yeah. So I can't afford him. Yeah.
I think he can smell the diabetes and the blood sugar and stuff.
Mm-hmm.
Well, you are a good doggy. Just step on my sore foot. Yeah.
You got mail.
Easy boy. Easy. He's a good boy. Good boy.
Yeah, there's black marks there. I think that's where it was bleeding.
Probably.
I ripped my toenail off and threw it away. Yeah. But I'm like you, I think it's trying to start a new nail.
That's good. It means it's healing really good then.
Well, time will tell. If I live until spring, maybe I'll be able to tell more about her.
How's your blood sugar been lately?
I don't even check it anymore.
Oh, jeez.
Why should I check it? If it's too high, I can't do anything about it. I know it's not too low because I haven't been getting any. You know, you can get them goddamn spells that'll flatten you if your sugar level gets too low.
Right.
Mine never gets low. It just gets high. Did you try any of the soup?
Not yet. We will as soon as we're more hungry. Yeah, your foot doesn't look like it's swelling too bad either.
Well, yeah, but look at...
Oh,
look
yeah,
at
right there at the calf, yeah.
My sock does that. It keeps them from swelling. Now, if I had a big knee-high sock, that would help. But I got they have them out at the drugstore for that kind of problem.
Oh, yeah, diabetic socks.
I have to buy so much stuff out at their damn drugstore, and I gotta buy that yet.
James is trying to lay across his feet.
They got me over at the hospital. Of course, they kept me in bed. They wouldn't let me get out.
Yeah.
Hell, I didn't have any swelling in my legs. They only swell when you're on your feet.
Yeah. I know that feeling.
And if I stayed off my feet and kept my legs up, they wouldn't be swell.
Well, it looks like Nanaki's trying to help your foot. That's why he's laying across them.
Well, maybe he can help.
How much sugar? I don't know.
He's
And
detecting
I should.
something.
I should at least have a sugar thing in case we confirm what he's doing.
I should
He probably won't.
keep my sock on.
Might be a good idea. He could be sensing the AFIB from how out of breath he gets, too.
You're a good doggy. Oh, I guess. Oh, that's the poor thing to say. I'm trying to put your sock on.
Good boy.
Oh.
The way he checks in.
He's like, okay, right.
I get out of breath so easy. They say my heart's bad.
Did they say if they're going to be able to do surgery to help with your infection, or?
We were going to get into that, but I have an appointment to talk with this, what do they call him, a cardiologist.
Oh, okay.
But they called and said I didn't dare to come over because the dangers of
COVID.
that
The COVID?
bubonic plague. They said, especially a man my age, they said they're going to do that over the phone.
Okay.
And I also had an appointment with a urologist over there to talk with him. And he wrote me a letter and said for a big long ago he gave me that it's going to have to change my appointment for about another month away and
Oh, God.
or longer. See, they tell me they're so busy over there that they don't even have a bed to put somebody in.
It's terrible.
With all this virus and stuff, that they're clear loaded up. They can't take any patients. Ambulances come in and they won't let them unload the patient.
Oh, God.
Yeah, that's what they got going over there.
Go.
And that's an awful big hospital. Was you ever over there?
Look, Guy Singer. Yeah. That's where I'm going to have the baby. I hope they don't just kick us out the minute the baby's born.
They got, was you ever through the children's ward?
Mm-hmm.
I was through that, and I'll never go through that again.
Those poor kids.
That upset me terrible to see what those kids were going through. There's a little guy, he wasn't more than about that tall, and they had all these tubings going down. They had one of those things with all them bags hanging on it to that poor little guy's body.
Aww.
And this nurse was walking him up the hall, and that poor little guy was just trudging right along, just like an old man.
Aww.
And he wasn't crying or anything.
Wow.
God, that hurt me. I had nightmares after that. I said, my God, I'll never go through that place there again. Not just one kid, but kid after kid in a hell of a shape.
Those poor kids, yeah, they suffer a lot.
It's awful. Of course, I'm sure they're doing good for those kids. It's not like they tortured them in there. Boy, they were rough on me. They cut my throat open, you know.
Oh, yeah? To get the blood out.
These big arteries in your neck.
Mm-hmm.
They cut my throat open. Didn't give me anything to do it. Cut me open there. Got installed stuff in there on them arteries.
Oof.
Oh, Jesus Christ, that was awful.
No, it's because the vessels in your arm collapsed.
I don't know why they did it. They did it one night. It was after dark. And they got in there, killed me doing that. And next morning, I thought, boy, I'm glad that's over with. And about that time, they come along and said, that's got to go. We got to take them back out. I said, we just put them in there. Well, they're only good for one time. So I had to lay there and let them take them damn things out that they installed in that artery on both sides and sew me up again. I went through hell.
Yeah, it looks like it.
They done awful things to me. all the veins in my arm where they were running all them needles and shots and stuff, they all collapsed. They couldn't use them.
Oh, God.
So they had to cut into that artery there in my wrist. And they did that without any painkiller. 2 nurses held my arm while the third one. Finally, I couldn't take it anymore. I put my face up against that one nurse and started to cry. And then I passed out. I couldn't take it. Well, when I come to, they were sewing me up. Yeah. I didn't think they could torture you like that in the hospital. I thought they would give you a little shot and numb you up. And
The only time they don't is in emergency cases to save your life.
I don't know what they were doing. And they left an implant of some kind in there. And later they had to cut it back open and take it out.
Oof.
Jesus Christ. That was awful.
You're just doing your job, huh, buddy?
When I was up at Williamsport, this girl come in there and started talking to me. She was a black girl, and I suppose she was probably about 14 years old.
Mm-hmm.
And then she introduced herself as a doctor. So she had to be a lot older than I thought. And she was a sweetheart. Yeah, she was a doctor. Yeah.
She took care of you real good, huh?
Oh, yeah, she was good to me. Look how funny the sky looks. You see that?
Yeah.
Huh?
Yeah, it's kind of dark and light at the same time. That's kind of crazy.
Oh, there's no cloud or nothing, is there?
I think it's nothing but clouds.
It's dark blue, dark like there's going to be a storm, and the sun's just shining.
Huh.
Jerome, I tell you. Jerome's an awful good friend of mine, but he's a preacher. And I don't believe a lot of the things he tells me, but he's an awful good friend.